आंखों में ख्वाबों के दिए थे जले और ताबीरें हाथों में लिए, चेहरों पे रंगों उमंगों की बहार, जैसे खिलने को हो कलियां बेकरार। इस चमन के फूल थे वो भी खिलना चाहते थे, जिंदगी को जिंदगी सा वो भी जीना चाहते थे। ढूंढे उन्हें जिंदगी, आज ढूंढे उन्हें जिंदगी। जिंदगी याद करती है, आज फरियाद करती है, राएगा ना जाएगा खून ये मासूमों का। अब जिंदगी हर खौफ से आजाद करती है, जिंदगी याद करती है।
Assalamu alaikum, ladies and gentlemen. Welcome to World This Morning. On a Monday morning, which is a Hashmi, of course, but it is also the 16th of December. In fact, indeed, a very tragic and horrific day in the entire history of our country, Pakistan. In fact, in the entire history of the world, ladies and gentlemen. This was the day when almost 5 years ago, the enemy of childhood, the enemy of Islam, you really can't say, even if you claim that you carried out all these attacks and then you claim that you belong to the Tehreek-e-Taliban Pakistan, who you claim works for, improving your religion and you're a fighter for the religion. You're really not if you are practicing all your might on children so young that they didn't even know they're going to go back to home after they came to school. Ladies and gentlemen, you all know this day, 16th of December, holds a very special, I can't even use bring together all the words to say this, a very special place in our hearts. And right now, when I say this, right now, when I'm talking to you about it, my heart's beating outside of my chest. Last year, ladies and gentlemen, on my show, I had families of the survivors, families of the martyrs. And that show was one of the hardest in the entire history of me being on PTV or me being on television at all. I could not bring myself to do that again. I could not bring myself to go through those images again. As ignorant as I might sound, please forgive me because I'm saying this, but those families are living continuously each and every single day as the 16th of December. We as a nation, as an individual, we only wait for this day to come and then, consider it as a black day and then, send out our prayers and hearts and love to all the martyrs and the survivors and their families. But the families themselves, ladies and gentlemen, there's no respite. Every single day, the mothers, the sisters, and the fathers, they wake up realizing that their loved ones were taken away from them. For what reason? For nothing. And then, of course, now we realize that it was a huge sacrifice for the entire nation. But did we really have to get the sacrifice from souls so young that, they were literally in Montessori or even not even in high school, even primary school, secondary school. On this day, ladies and gentlemen, around 144 people in APS Peshawar, Kent lost their lives, more than 120 of them students, along with, of course, their teachers and the people working at and around APS. Today, as a nation, as Pakistanis, as Muslims, as brave nations, let's all together pray for them, of course, observe silence for them, pray for their families who are left behind in this really dark world where every other day they have to think about them. They have to come across something that reminds them of their loved ones. They have to come across their pictures as well. They have to get over the fact that this did happen, but they cannot seem to because it's such a harsh reality, ladies and gentlemen. I really didn't want to start your day on this note, but this did happen. And around this time as well. When such a reality strikes your nation, ladies and gentlemen, it is our responsibility to come together hand in hand. And I think we did see that as well. This was in, December when it happened. The nation, Pakistan Army, the government, private, public sectors, each and every single one was all together, but in shock. And I think that is the legacy of bravery that we're taking forward, of the martyrs, of the martyrdoms that took place on this day, ladies and gentlemen. Right now, I do have a very motivational song for all of you who are watching the show right now. Might you be students, might you be parents, grandparents. We all as a nation do consider that the people who did lose their lives were our own loved ones. And this one is for them. Let's take a look at this. This, ladies and gentlemen, in the face of all those people who in the entire world believe that Pakistan, is definitely under an epidemic of all the activities, terrorism related, that we went through. But we are not, because, of course, as a nation altogether, we fought that. And as courageous and as brave we are today, we will be even more in the future, ladies and gentlemen. This is the promise to all our coming generations. This is the promise to all the martyrs. This is the promise to each and every single person who is going through this and living in Pakistan and fighting for the best of Pakistan to come in the future. Other than this, ladies and gentlemen, if you watch our show, you know that we love coming up with ideas that serve our society, that serve our communities, and for the people watching out there, that really gives them something to think about throughout the day. So this is what we will be doing today as well. It's December, yes, but on the 1st of December, it was a very important day internationally. Ladies and gentlemen, the United Nations was globally observing World AIDS Awareness Day. And being a member state of the United Nations, Pakistan loves to educate its own people, loves to move forward and to, especially on the path of achieving the SDG 2030. So when we're talking about AIDS, first of all, this entire month of December is, dedicated to observing the awareness related to AIDS, and then also disseminating information and education to each and every segment of the society out there. This is an epidemic, ladies and gentlemen. It started not so long ago. I think it was in the 1980s when the first case of AIDS was reported. And ever since then, 71 million people have been reportedly diagnosed with AIDS, and 34 million of them died of it. Imagine that. I mean, this is such a staggering number. For me, it is definitely, because every other day I get to learn so many things, and then again to believe that even as a society in Pakistan, we have similar cases going up. It's ever since last 2 months, I think all of you have been watching in the news as well, in major parts of Sindh, like Larkana as well, Rattodero as well. Even in Attak recently, there were reported 350 cases of AIDS, especially in children. My mind is not in its place, I mean, to think of how these are going on, but there are so many reasons of how AIDS can spread from one person to another. And because I'm not an expert on that, I have a very apt panel of guests with me over here. But before that, let me tell you the theme for this year, 2019, is communities coming together. When we're looking at AIDS, ladies and gentlemen, it is so stigmatized, this particular disease. And should I tell you one thing, not only in Pakistan or not only in society like ours, throughout the world, this is so stigmatized. People really don't want to come up, volunteer to check themselves, diagnose themselves. And even if they get diagnosed, they are never going to tell someone that they have been going through this, and then probably die with it as well. Medications, yes, treatment actually, not even vaccination, treatment was available in the late 1990s. That is what has been going on, and that is what actually people who have been reported to live with AIDS are living now with. It becomes a lifestyle because it's not going to leave you when it gets, stuck on you. So if you have it, if you have been diagnosed with it, ART is there to help you, ladies and gentlemen. We will get into the depth of that as well, how that was discovered, what that is doing to the people living with AIDS as well. For this reason, ladies and gentlemen, from IMDC, the Islamabad Medical and Dental College, I have an amazing team over here. First one of them being Professor Dr. Rizwan Aziz Qazi, the consultant internal medicine. Assalamu alaikum, sir. Welcome to the show.
Thank you very much.
Thank you so much for coming here, sir. Next to Dr. Rizwan, we have someone who happens to be in charge of the blood bank as well, also consultant hematologist, Dr. Nahid Naqvi. Assalamu alaikum, ma'am. Welcome to the show.
Thank you very much.
Next to Dr. Nahid, ladies and gentlemen, we have a public health specialist, also a family physician, Dr. Ahmed Abdullah. Assalamu alaikum. Welcome to the show.
Thank you.
To begin with, sir, I think I'm going to ask you to present us with the stats of prevalent AIDS in Pakistan, and then also the theme, communities coming together to fight this. What does this mean to you?
Well, the national figures are right now 1,60,000, which is the latest number coming from NACP.
All right.
And but out of these 1,60,000, those who are registered in the treatment centers, around 48 treatment centers in Pakistan, they are around 38,000.
Okay.
So there's a big number of HIV cases who are still missing. So regarding the word communities coming together,
Yeah.
of course, this disease has been little stigmatized, as you already talked about in your introduction.
Yeah.
So people have been avoiding even sharing their disease with anyone.
Right.
So we have communities where the disease is prevalent to a concentrated epidemic, and there are people who are getting exposed just because of their risk factors.
Right.
So this is the right time that everybody comes forward they are sort of supported by the community so that they identify themselves, they come to the forefront. They should offer themselves for the testing, they should offer themselves for the medication, because the medication which is now being provided free of cost through the government's channels is very effective, so much so without any side effects, so much so that somebody who has been started on the first line medication, they have survived for years and years without any problems.
Oh, that's
So
amazing.
yes.
Okay.
So this is how this disease is. So knowing that the disease is there, you cannot deny the fact that it is not there.
Exactly.
We always talk about that this is a Muslim country, so the disease is not there. But as we know, it is not just the mode of transmission is just not the sexual route, which is usually thought about that it is because of some bad activity. This is not true. Internationally, yes, sexual route is the highest way by which the disease can be transmitted, but through blood and its products, like somebody getting a needle stick injury, an innocent person going to a general practitioner getting an injection with a syringe which has been reused on multiple people, and one of the individual the syringe was used was having an HIV disease. So this is how the disease can be transmitted. So then if there is a female who has got HIV infection, conceives and is pregnant, has a very high percentage that would transfer disease to the newborn if this lady or the mother is not properly taken care of by different interventions, that is by through introducing ARTs in this lady.
All right, thank you so much for saying that. We will definitely get to the detail of all the things you mentioned, especially how government is providing free medication for the patients. But moving on to you, Dr. Naqvi, you've been working in the blood bank for a long time. You're a hematologist as well. We so far know, and all the people out there, if you don't know, you will learn right now, that AIDS you can develop, of course, through blood transfusion, especially through used or reused syringes as well. Please let us know the details of that.
Yeah, thank you very much. As Dr. Rizwan mentioned, blood and its products, they are one of the major routes of transmission.
Okay.
And I would highlight the importance of provision of safe blood, especially not to all people, but to all people, and also especially to people who are multiply transfused, like thalassemia patients who are receiving blood, and they especially red cell concentrate. They are receiving once a month or sometimes even twice a month. So they are at a much higher risk of getting these infections. And for every blood bank, it should be mandatory to screen for at least 5 diseases. These include hepatitis B, C, HIV, then syphilis and malaria.
Okay.
And WHO also recommends that every country should have their policy that there should be stringent screening in all the blood bank for these diseases. And this should be done by best methods, because rapid screening is done in many places, but it is not recommended, and we can miss many cases of positive cases in rapid screening. So I would highlight the importance, and through your program I would convey to all the stakeholders that they should try to screen all the components of blood before they are released by best possible method, which is either through ELISA, chemiluminescence, or if they possible NAT testing, which is the I think gold standard testing for blood products.
Right, that's absolutely right. So ladies and gentlemen, you know, when I was in conversation with this amazing team right before my show, they told me that AIDS is not something like, it's not a disease that you develop just overnight or something, or probably over a month or something. It is your immune system is getting deficient of all the things that it needs over a period of time. It can sometimes even take 7 to 8 years, you mentioned, right? Yes. So Dr. Abdullah, my question to you is, for all the people who don't know out there, AIDS, what it stands for, how does it develop? And of course, we know the ways of its transfusion, but I mean, how does it develop? Because also I was reading that there are certain key indicated diseases that could lead to AIDS as well.
So HIV is the human immunodeficiency virus, and AIDS stands for acquired immune deficiency syndrome. Right. So HIV is the name of the germ that causes the condition, and AIDS is the eventual consequence of that germ getting into someone's body.
Okay.
When it is transmitted, we have the concept of incubation period
All
in
right.
diseases, especially in infectious diseases, which is the duration of when the germs enter someone's body and the time it takes them to, manifest the symptoms of the disease. In HIV, the incubation period is very varied. It could be short,
Okay.
to a couple of months, and it could be as long as 7 to 10 years.
Oh, all right.
So that depends on what the state of the patient's immunity was before they contracted the virus.
Okay.
This disease is spread, we know the modes of transmission. It is spread through sexual intercourse,
Right.
unprotected. It is spread through blood transfusion, and it is spread through inoculation using surgical instruments or reuse of needles.
All right.
So in Pakistan, the most common method of spread is intravenous drug use
Okay.
and needle sharing. The
Right.
second most common method is through the transgender population who engage in sexual activities.
All right.
And then we have the other commercial sex workers.
Right. But sir, I have a question for you. When you mentioned that in Pakistan, the most common case is, reusing the syringes or needles as well. I understand, of course, that does happen in terms of drug users. I mean, of course, they're not really, let's say, they don't really care about the health as well. So that is one of the most prominent ways of transfusion, yes. But when you're looking at children, and hundreds of thousands of cases of children being reported, they're not using drugs. How are they developing AIDS through syringes?
So we're one of the countries in the world where we're obsessed with getting injections. And, the average Pakistani gets 13.5 injections per year.
Per year, all right.
The recommended rate is around 3 to 5 per year, and that too. So we're getting injections for things that they're not needed for. Most of the HIV pockets that have been discovered in Pakistan have been in smaller cities, Ladkana, Kot Mubarak, DG Khan, Sargodha, and just to name a
Similar
few,
places,
Bannu, across all provinces. So the issue is that there's a lot of unregulated health practices going on in these cities, and there's a lot of quackery going on.
Right.
Plus, there's a lot of reuse of syringes in these cities as well. That is, we were facing a concentrated epidemic, which means that 5% of the high-risk population, 5% or more, is infected. So we don't have a high prevalence in the general population as of yet, but the high-risk groups have a pretty high population prevalence of the disease. And then we have these bridge groups, clientele of sex workers, spouses of intravenous drug abusers, truck drivers, migrant men, people who are deported from other countries because they have an HIV positive status and then decide to come in silently and
and never actually let anyone know about it as well, and being the people who transfuse as well and transmit to other people. We'll get back to you, sir, but I think you very rightly mentioned and actually highlighted a very important point, that we as a nation are obsessed with injections, and that is true. I think all of you who are watching right now can also sort of relate to it. If something goes down with any of your the people living at your place, even if it's a headache, we need to see a doctor. I mean, of course, I do not really stand by the idea that Google is your doctor. That's a good thing that you're seeking advice from a professional. That is absolutely what you should do. But I think it gives us a sense of, let's say, satisfaction that I just got an injection, everything is going to be all right with it. Even with a lot of girls as well, I mean, in their menstrual cramps and whatnot, if you get an injection, everything's going to be all right for you. Yeah, because it's a painkiller. Of course, it is going to treat things for you for a while. But it's an injection. I mean, really, think about it. I don't know why we don't take it as something important or as something that should really bother us, but I really hope we do eventually. But so, Dr. Ahmed mentioned some of the key areas or risk areas, the vulnerable population. Can you point out who those are?
Yes, you see, in Pakistan, the disease is endemic, less than 1%. So nothing to worry about when you talk about the nation as a whole. But we have key populations, and these key populations, they are harboring very high percentage of HIV. So the key populations are the sex workers usually, the female sex workers, the male sex workers, the hijra populations, and the IV drug users. And then there are professions like people who have been outside the country, they got exposed, they came back, and they still are indulging into their bad sex practices. So these, the highest percentage has been reported among the IV drug users, and there was this figure of 37% positivity of HIV in this group in one of the study in Rawalpindi, Islamabad. So this IV drug use is a very common prevalent practice among a good percentage of the people in many places in the country. So the figures are very scary. If you talk about hepatitis C, it is 100% in this group, and it is 37% for HIV. So if you can imagine that this group is not only abusing drugs, they are doing other bad activities also. So they are basically the source of transmitting disease among the community. So very dangerous so far these key populations are concerned. So we use the word concentrated epidemic for this group because it is very high among, even there was one study among the jail inmates. Once in Ladkana there was an outbreak among the IDUs inside the jail, and the number was reported as 70%. So you imagine it's a very scary number, and because unfortunately the drug user would not do the practice alone. They would sit in the groups, and they would reuse syringes, and they are drawing blood, injecting, drying, injecting, and this is their practice. So even if there is a very low percentage of viremia in the syringe, it would be guaranteed that it would get transmitted in anyone who is using that syringe subsequently. And just adding on to one of the concern you showed about among the children, just to highlight one point, that children have a very low immunity. Their immunological system is very weak till they reach the age of 5 years. So less than 5 years they manifest with the disease quite early. And if it is from mother to child transmission, it is very unlikely that child would survive unless supported by medication more than 2 years. So it is again something very important to understand.
Of course, thank you so much for enlightening me and my audiences as well. But now I'm going to ask you guys one by one some very basic questions that I feel like as a nation, or as laymen actually, we do have them. You can call them myths, misconceptions, even some basic questions. Moving on to you, ma'am. One thing, first of all, we have established here, it does transfuse, it transmits through blood. But is it viral? I mean, touching someone with AIDS, shaking hands with them, hugging them, does it transmit? Because people do have this sort of reservation.
No, I think it's only transmitted through either using syringes or giving blood to the patient which is infected, or any components of the blood, not through handshaking or any or through sexual contact. One thing more I would highlight through this program, that voluntary blood donation is one of the factors which will also reduce the chances of transmission of infection through blood products, because most of, in Pakistan the figures are showing that most of the donations over here are replacement donations, whereas the safest donors are the voluntary blood donors. And one of the reports of Safe Blood Transfusion Program Pakistan showed that they conducted a study in 2018 and published a report, and they mentioned that we had only 18% of the voluntary blood donations in Pakistan, and we should promote and we should highlight this point to our nations, that we should go for voluntary blood donations, because when we are going for replacement or family donations, then people usually hide, because whenever they are in urgent need of blood, they would hide the things. And this is the factor which can lead to transmission, presence of the virus in the blood, and if it is not screened properly, then it can be transfused.
Right. That is such important thing to know as well.
I was thinking that this should also be, there should be programs and there should be awareness campaigns regarding voluntary blood donations, because this is the safest blood.
Of course.
Thank
you so much for saying that. Now, before we move out to a very short break, ladies and gentlemen, and again, a very basic question that I need to ask Dr. Ahmed over here. I think Sir did mention, but to my clarity, I'm going to ask again. A mother who has AIDS and then she delivers a baby, what are the chances of the baby developing AIDS for the rest of his life, either through, let's say, through the delivery or through breastfeeding?
Basically, if she's being treated on antiretrovirals, which stands for ART,
Right.
these are drugs that kill the virus or they limit its spread and its growth. So there have been experiments, successful experiments, where an HIV positive mother has been given these antiretroviral drugs in the final stages of her pregnancy,
Okay.
and then the mode of delivery of the child, where they have prohibited the baby from getting the virus.
Oh, okay.
It is released in breast milk as well, and this is a changing paradigm.
Right.
Initially, they said that an HIV positive mother should not breastfeed her child. Then there was this idea that if she's on ARVs, she could breastfeed. And now they're talking about letting her breastfeed the child. But yes, it is preventable. This mode of transmission is called vertical transmission,
All right.
where the virus is transmitted from the mother to the child,
Okay.
and the child is developing inside the mother. So there are chances of getting the virus during the process of development.
Right.
But the most common time of transmission of virus is when the baby moves through the birth canal.
All
So
right.
if there's a cesarean section at that point and the child is not allowed to move through the birth canal, that could also reduce the chances.
The chances of developing
yeah.
HIV for the rest of life. Okay, that is of course sort of a good news, because if ART is working for mothers who are HIV positive, there are still chances of the baby being HIV free for the rest of their life. Ladies and gentlemen, when I was reading up on the United Nations website, it said by 2030, it's a pledge to completely remove HIV, tuberculosis, and malaria. Are we going to realize the dream that we have dreamt of? This is what we will talk about with this amazing panel. But after this very short break, please stay tuned. Good morning. Welcome back to Well This Morning, ladies and gentlemen, which is a Hashmi on a bright, pleasant morning, of course, where today, like every other day, Well This Morning is educating you about matters that are so relevant and so important to our society as well. Ladies and gentlemen, today we are sort of remembering the 1st of December, where we celebrated International World AIDS Day, but December entirely we have dedicated towards the awareness of this HIV AIDS disease that is now prevalent in our society as well. There are some achievable targets that United Nations pointed out, and I'm going to ask my panel of guests over here if they really are achievable or not, or if they have been achieved or not. And they say that 90% of all the people living with HIV will know their HIV status by 2020. Sir, is that going to happen, or is it anyway, are we nearly close to that as well?
Well, you see the figures from Pakistan. We have registered cases around 38,000, and the calculated figures are 1,60,000. So there's a big gap between those registered and those actually prevalent, carrying the infection in the country.
Okay.
So maybe even the total number 1,60,000 is less, but this is how the figures are.
Okay.
So these sort of programs which we are sitting right now, these are the campaigns basically where we have to improve the awareness among the general public, so that they volunteer and they come forward and get themselves tested. So knowing 90% may not be achievable, so in 2030 at least, but at least 50% or 60% should know their status, because as has been pointed out, that this disease, it is there, would not manifest with clinical signs for many years. So if somebody is harboring an infection and is not known to have the infection, is always a risk for the community, because can transfer the infection to the partner, or maybe if he is donating blood or is getting himself injected by different for different reasons. But knowing their status would of course help the community to restrict the transmission in future.
And I think so the next point you can also answer as well, because you actually spoke about it in the beginning of the show. 90% of all the people with diagnosed HIV infection will receive sustained antiretroviral therapy. In terms of Pakistan, please do mention what the government is doing too.
Well, you see, the availability of drugs is free of cost, and these are available from 48 centers, which are right now, rather I would say 49, because we just started with the new center at Islamabad Medical Dental College recently. So one of the rare thing in the private sector which has been started now. So the free availability of the drugs from these places without any cost involved to people who can volunteer to select any of the center which is nearby and get the drugs, but they have to be consulted about the compliance of the drugs, so that they do not go on to develop resistance if they observe some drug holiday, or they abstain from regularity of the drugs taking. But you see, if this thing is free of cost, available to everyone, the drug compliance can become a possibility, and achieving may not be 90%, but at least a majority of the people should be getting the drugs free of cost without any problem. They don't have to travel long distances, and they should comply with the drug therapy. But here I would like to add just one very important practical point. These IDUs, they are very dangerous population, because they come to us, they are started on the treatment, they would do very well there with the response for after the drug has been started, but after they have the good quality of life, they go back to their original practice of drug, misusing drugs and staying away from ARTs. So this is the biggest problem. So there are many NGOs working with these drug users to just ensure that they may continue with the drug abuse, but they have to follow some rules and regulations, and they have to comply with the ART therapy. So maybe we can achieve in majority of the cases the drug administration may be started, and we have to just ensure that they comply with the instructions to continue with the drug, not missing the doses, and they can have a very normal quality of life.
All right, so it really depends on the person who is taking all these medications if he wants to improve the quality of his life, like Dr. Saab said over here. So are you telling me anyone in any society who has, who has been proved HIV positive can go to these public places and receive the medication for free?
Yes, it is
Okay.
available for free. The initial diagnostics are also available for free. They can have their diagnosis, confirmed diagnosis from these centers,
Okay.
and they would be started on the treatment free of cost and regularly monitored after say every 3 to 4 weeks. And once they are compliant and they show the viral load going as less than 50 copies, what we call as the non-detectable viral load,
Okay.
then they can even visit the centers less frequently and continue with the
Right.
treatment, having the big supply of the drugs available from these centers
All
without
right.
any issue at all.
All right, that's just amazing. So, ladies and gentlemen, since we're left with just a little time, I really want to talk about awareness over here. Because when we say we're celebrating International Day for AIDS Awareness, it's not just something that goes under the credentials of the United Nations or just goes on their website that, okay, this is one of the things that we do. This really has a purpose behind it. For everyone out there who is watching, I really hope you spread it towards your friends as well. You share what you've heard from us as well. You educate your surroundings, because awareness is what we're looking at. Of course, we have certain goals and targets that we need to achieve by 2020, even by 2030. By the way, the SDG says that it should get rid of malaria, tuberculosis, and HIV already. We can only achieve all those things with awareness. So I think you, Dr. Ahmed, are going to be the one who should speak over here, since you deal with public health, right? So in terms of awareness, how should we go about it? Should we really develop the human rights approach? Because when we have to make the person who has been diagnosed, make them feel comfortable at least in first that you are still dignified, you're still going to have all the same kind of life that you already had, but just a little difference in the lifestyle.
The first thing to understand over here is that any kind of disease is a process happening in nature. We're a
Right.
part of nature,
Right.
and it's a process. So when we amalgamate the concept of sin with diseases, that's what worsens things.
Okay.
So we need to understand that anyone could get any disease. It doesn't have to be a bad person who gets a disease.
Right.
People get sick.
Right.
And the part of this, the most important part out of this is that we need to stop discriminating people based on their diseases, not just HIV,
Absolutely.
on mental health issues.
Absolutely.
I've seen people being discriminated on diabetes. So we need to focus on human rights. So that would be a good approach for this.
Absolutely.
Having said that, HIV has greater implications than other diseases because of one of its mode of spread, which
Yeah.
is sexual.
Yeah.
And we
But
need.
that's not the only one, though, right? I don't know
There
for
are
what
other
reason,
modes.
as a human race, we've just.
When the disease was discovered in 1981,
Yeah.
the first time, for the first year, it was called GRID.
Okay.
Gay-related immunodeficiency.
All
And then
right.
during the course of that year, they discovered other modes of transmission, which were vertical and through inoculation and through blood. And then they called it acquired immune deficiency syndrome. So it can be acquired through other reasons as well. Irrespective of the fact, we should hate the disease, not the patient.
True. Thank you so much for saying that. All right. So thank you so much, first of all, for being on my show, and especially to talk about something that is, yes, stigmatized, but so important to let it out there. Everyone needs to know just the basics of this. And this is, I think, what we did on this show today. So towards the end, I'm going to take some closing notes and let's say awareness or inspiration from all of you who know about it to all the people who don't know about it. Let's start with you, sir.
Well, the myths about transmission need to be very clear that it is not something which is transmitted even with any sort of social contact with any person. So the general sort of feeling that this is disease or virus would get transferred or transmitted very easily, this should be totally clarified, and this myth should be totally abundant.
Thank you, sir. Ma'am, Dr. Nagmi, this is your camera. Please speak to your people out there.
I think I would say that stringent donor selection and meticulous screening are the two ways by which we can stop transmission of disease through blood products. Number one, and number two, if anyone is found to be positive on any of the donor is found to be positive, they should be counseled, and they should not be informed on just phone and something like that. They should be invited, they should be counseled, and they should be referred to proper HIV centers.
Thank you, ma'am. I think that was very important. Counseling is so really important for a person us in dealing with this. Moving on to you, Dr. Ahmed, your closing notes, please.
In terms of the sexual part of the disease, I would suggest people to be faithful. That is something really important.
Of course.
And promiscuous sexual activity should not be, a part of our society.
Of course.
Which it is being
Unfortunately.
projected as. And the other thing is that injections and infusions are meant for people who are unable to orally intake medication. So we should understand this and increase our threshold of pain.
Yeah.
And start using medications. And even better would be if we adopt healthier lifestyles, so we don't need any medications or injections on a regular basis.
Right, absolutely. Thank you so much for saying that. Thank you for gracing my show with your presence as well. Dr. Naghmi, Dr. Rizwan, and Dr. Ahmed. Ladies and gentlemen, today we were trying to raise awareness about the epidemic that we know as AIDS. Just know that AIDS is not, of course, it's a large issue to face, but it's not larger than life. It's not larger than our courage. So I feel like as a community, as individuals, as a nation, all together, as a global nation actually, this is not something entirely for Pakistan, but for everyone out there throughout the world as well. Let's come together to face this. I mean, if you know someone who has been diagnosed with HIV, tell them or sort of counsel them in a way that they tell everyone about it themselves. The secrecy that we have to sort of connotate with it, this shouldn't be there. I mean, if you're facing something, you should be able to speak about it and then raise awareness about it as well. There was a drama as well on one of the Pakistani private channels, I cannot really recall right now, which the storyline was basically based around a woman who had unfortunately developed HIV from somewhere. And the story revolved around how, everything was stigmatized for her, everyone hated her, and how eventually she was disowned by the entire family. This is actually the harsh reality of, this specific epidemic in Pakistan. So let's all together rise above it, ladies and gentlemen, educate, aware, so that we can, come finally to the solutions of it. And if there's any query, if there's anything you need to write to us, write on our Facebook page with the name of Well This Morning, on Twitter, Well This Morning without a G, Daily Motion, YouTube, also Well This Morning, and the repeat you can catch at 11 p.m. tonight. Till the next time, good morning.